Hi, Thomas Mestre.
Yeah, that's my name.
Hi, my name's Alicia. I'm going to be your nurse today.
Hey, how's it
You're
going?
here for your physical, your yearly physical.
Yeah, that's
All
right.
right. All right, so I just want to check. Your date of birth is 7/20/1988.
Yeah, that's correct.
All right, great. So I have a list of questions we're just going to walk through. It'll just get us a better understanding about where you are health-wise. Okay?
All right.
All right. So we're going to start off with past medical history. So, currently, do you have any illnesses that you're dealing with on a day-to-day basis? Something like diabetes, thyroid issues, anything like that?
Last time I got blood work, I was pre-diabetic.
Okay.
But I haven't got blood work since. But I've been trying to, make sure it goes down. And all
Okay.
that.
All right. All right. As long as you're, trying to eat healthy, exercise, do all that to keep it under wraps. I know your doctor will order more blood work after you leave today, so you can get that done. Did you have any major childhood illnesses, and possibly like how long were you sick with the illnesses? Anything from chicken pox to measles to leukemia, anything?
I believe I had chicken pox long when I was a kid. I
Okay.
can't remember, but I know it wasn't severe at all.
Okay, fantastic. And recently, have you had any like acute illnesses such as a cold, COVID, pneumonia, anything?
Months back, I had, I think, a cold or a sinus infection.
Okay.
But a cold, yeah.
A cold, okay. And you're able to miss out on COVID so far, so that's good. And you're vaccinated, wonderful. And we'll go through a little bit of family history. Are there any major illnesses that have affected your mom, your dad, or any of your close siblings?
My dad's side of the family, diabetes is prominent.
Okay.
My father isn't diabetic yet, but he is teetering on that scale.
Okay. But that's good that you're keeping yours in check, making sure that it doesn't, progress into major diabetes. All right, so health-wise, nutrition-wise, can you tell me what you would normally eat in a day? Just a simplified version.
Probably some eggs, banana, salad, and maybe some chicken and rice in the evening.
Okay, and you have caffeinated beverages throughout the day?
In the morning,
okay.
Not in the afternoon.
And you try to have enough water during the day as well?
As much as I can keep up with,
okay.
Yeah.
All right. And you gave me a list of your recent medications. I see you are on some antidepressants. Have you had any side effects such as dizziness, any rashes, headaches that could be, we could possibly contribute to those medications?
I have been feeling dizzy sometimes, and sometimes I feel like I blank out from it or fogginess,
okay.
But I'm not sure if it's that.
Okay.
All right. It just comes and goes.
Perfect. All right. Well, I can pass that along to the doctor. We can talk about that, about medication dosages and stuff. And are you taking any daily, like, over-the-counter medications, vitamins, CBD products, minerals, anything like that?
Take daily gummy vitamins.
All right. Awesome. All right. And have you had any past surgeries in the recent years? I mean, it could be as far back as childhood or in the past couple of years.
Last surgery I had was like in 2001 for removal of my appendix.
Okay.
Nothing serious since then.
All right. Fantastic. Okay. So we're going to talk about like your level of activity and exercise. On an average day, how much physical activity would you say you get?
Average day, probably 3 hours.
3 hours? Okay. And what are some physical activities you enjoy doing daily?
Walking my dog.
Okay.
Staying outside in the garden, a little bit of yoga here and there.
Okay, perfect. All right. And sleep and rest wise, and this is a tough one. How many hours of sleep would you say you get every night?
I gotta say 5 hours, maybe 6.
Okay. And when you get like 5 or 6 hours, do you feel like you're well rested enough? Do you wake up groggy, achy?
Achy, yeah.
Okay. All right.
Achy and I'd say crunchy.
Okay.
Joints get
Joints get.
Yeah.
Okay. All right. All right. So recently, have you had any odd symptoms that you really can't explain, such as like a prolonged headache, stomach ache, a rash, or even itchy skin?
Uh, I've been getting eczema, but I've been getting those since I was a kid.
Okay.
They come and go randomly. I don't
Okay.
know.
Yeah, and I saw you were on a topical medication for
Yeah,
that. So
I got
does that
that.
seem to help?
It helps when it
Okay.
gets severe. Yeah.
Okay. All right. And any unexplained weight loss or weight gain in the past 6 months?
I feel like I've been gaining some weight.
Okay.
I feel like I've not been as active as I usually am, and been eating more.
Okay. Do you think as summertime approaches, you'll be more active?
Oh yeah, more
Okay.
active. I'm gonna be outside a lot.
All right, perfect. And have you been keeping up with like other specialty appointments, such as the eye doctor, the dentist? And can you tell me how recently you've been to either of them? Don't need an exact date, but just ballpark.
6 months ago or so, went to the eye doctor.
Okay.
Dentist, been a few years.
Okay, perfect. And any other symptoms that could be out of the ordinary? Like I had said, dizziness, blurriness of your eyes, itchiness.
Blurriness occasionally.
Okay, and you wear contacts, right?
Yeah.
Okay. I mean, it is allergy season. I saw you do have seasonal allergies,
Yeah.
so it could be attributed to that. But again, I will pass that along to the doctor when it comes in. And just some stuff about your like social life. I'm going to ask you questions again. These are questions we ask everybody, so they're not personalized, just for you.
Right.
So how often do you feel that you get proper social and emotional support from family and friends?
Every day. Yeah.
You have a good support system.
Yeah. Family and friends, mom, girlfriend.
And what is your current occupation?
Landscaper.
Awesome. So you're outside. That's perfect, especially this time of year.
Mm-hmm.
So in the past year, have you had to go without any necessities such as food, electricity, transportation?
Bill's got a little behind because of lack of work,
Okay.
but other than that, everything was fine.
Perfect. All right. Are there any like traditional remedies that you use to help with your ailments, like in kind of herbs, acupuncture, possibly like yoga?
I mean, I do yoga, but ever since I was a kid, my mom put vapor rub all over my chest all the time, and to this day, I can't feel better unless I actually have it
that.
on me. Yeah.
All right. Are there any religious or spiritual practices that you follow that we can incorporate into your medical care?
I'm not religious,
Okay.
spiritual, but I don't practice.
Okay. Just some stuff about safety and at home. Do you have smoke detectors and carbon monoxide detectors in your home?
Yeah.
All right. And how often are you testing them and changing the batteries?
Once a month on average, yeah.
Fantastic. All right, we're kind of going back to the work thing on the landscaping. Would you say your job is a stressful job or not very stressful?
Not very stressful, no.
Okay. And do you feel like that it's fulfilling to your life, that it gives you a little bit of purpose?
Yeah, it does.
Awesome. All right. We're just going to talk a little bit about your past history with, self-harm and stuff like that.
All right. Yeah.
So recently, have you had any thoughts of harming yourself or others in about the past month or two?
No, not the past months.
Okay.
Half a year back, maybe.
Okay. All right. And do you talk to somebody about these thoughts of self-harm?
Yeah, I do.
Okay. And are you seeing a therapist for these thoughts?
I really can't afford a therapist.
Okay. Well, before you leave today, I can get you some resources for therapists and like community centers and stuff that are more, reasonable, and we can hook you up with a social worker as well. Okay.
Okay.
All right. It was very nice meeting you, and I will have the doctor come right in.
Thank
All
you.
right. Good one.